Hi and welcome to another OET lesson. In today's lesson, we are looking at the speaking subtest. From the previous lesson, we know that the speaking is a role play and you have to act your profession on the day. There are two of them. And very often this is a consultation. So you as the candidate as the professional, and then the OET representative as the interlocutor who is acting as a patient or the relative or carer of the patient. You have the setting, so always you'll be given the setting. All of this is presented to you on a task card. So the setting, the scenario, and then the task. So the setting could be in a hospital ward. Then you could have a scenario giving you probably the background of the patient or the care of the patient you're taking care of. And then you have your task. There may be a number of them, and you have to ensure that you act your profession. So you're acting as a nurse or a doctor or a dentist, whatever your profession is what you're acting on the day. So let's look at the subdivisions of the 20 minutes that you have. The first 4 minutes is used for identity check and warm up. Of course, the interlocutor should know who has presented him or herself for the test. So your name, where you're coming from, your profession, and any other relevant questions that would establish your identity. Then the second part is the warm-up, where the interlocutor would ask you a set of questions for you to tell him or her more about you. For example, what made you take up your job, challenges you encounter, and some others. This stage of the test is not awarded any marks whatsoever. It's only to help you, especially the warm-up. It's to help the candidate and the interlocutor get used to each other's voice, each other's accent, their pitch and all. You're supposed to get used to each other's voice at this point. It is not awarded any marks, like I said, but it is very necessary, especially for the candidate, to help you ease into the test that you're about to take, because at this point you're very anxious. You are nursing so much anxiety as to what is going to happen, how is this going to go, is it going to go well, and all of that. So this part is to help you to relax, to become calm and cool for the actual test to begin. Then the 3 minutes afterwards is for preparation. So you have 3 minutes each to prepare for the 2 role plays that you have. You're supposed to make down some notes, jot down some points, write down some questions, some things that you're going to say. With regard to the tasks that you have, remember, all you need to do has been outlined on the task card. So that should aid you to prepare for the actual role play. Make sure that you use these 3 minutes very effectively, because your inability to prepare at this point would mean that you are not likely to deliver to the best of your ability when it comes to your communication in the English language, as well as your acting of your profession on the day. You can ask the interlocutor some questions bordering on the task that you have or the setting that you have on the task card. Then you have 5 minutes each for the actual role play, where you're supposed to deliver with regard to what you have on the task card. In all, you have the 20 minutes. So 4 minutes plus 3 minutes, 3 times 2, that's 6, plus the 4, that is 10, then 5 minutes each, that's 20 minutes for the speaking. Let's look at what you're supposed to do, how you're supposed to go about it, or better still, what actually happens during the speaking subtest. asking of questions. Both the candidate and the interlocutor are supposed to ask questions. Remember, as a candidate, it is your test and not the interlocutor's test. And so a greater part of the responsibility of the role play lies on you as the candidate. You should be able to ask enough questions to elicit some good amount of response from the interlocutor who is acting as the patient or carer or relative of the patient to help you get the necessary information. So you're assuming that this is something I'm doing at the workplace. You need to write you need to ask the right questions, open-ended questions, close-ended questions, and what have you. Then you should be prepared to respond to the patient's questions. Both of you are not going beyond the task that you have, although there's a tendency for the conversation to veer in a different direction, so to say. However, you should always make sure that you are sticking to the task that you have as the candidate. You need to answer the patient's questions. Then you should be prepared to engage with a variety of patient types. Am I dealing with a patient who is upset? Or I'm dealing with one that is unwilling to provide me the necessary information? You have to tweak your questions, your outlook and everything when it comes to the type of patients that you're dealing with. You should be ready to explain medical conditions and treatment. These are always, the speaking is always profession specific, and so there's not really anything that you cannot explain to the person. Moreover, what you have to deal with are not very uncommon medical conditions and treatment. Of course, everything would be given to you, almost everything will be given to you on the task card, so you can do this very well if you prepare. Then you should be prepared to rephrase ideas in a variety of ways to help or persuade a patient. For patients who would be unwilling to accept, let's say, recommendations, you should be able to put your suggestions in different ways to help them agree with you on that particular one. You should be able to reassure. Okay, for patients who are very worried or angry, you should be able to reassure them during the speaking test. And this is what you'll be doing if you have to do the speaking on the day of your test. Cheerio, and may your efforts be fruitful. I'll see you in the next lesson.